Hi, welcome to our channel. Today I will answer the question of why elderly people are prone to tooth decay. Let's talk about it, why we should worry about this, and at end of this video. You will not only be equipped with the knowledge, but you will also know how to prevent it. Factor 1. Receding gums. As we get older, the gum tissue naturally pulls back, exposing what's called the tooth root. Now, if this were just a little bit of the root, it wouldn't be a big deal because the tooth has a protective covering called cementome. Cementome is similar to bone and it covers the root. But unlike the outer tooth enamel, cementome is much softer and more vulnerable to decay under attacks of bacteria. Factor 2. Dry mouth. Now, this is by far the #1 culprit when it comes to seniors getting cavities. We call it in the office xerostomia, which is a fancy word for dry mouth. Have you already experienced this? And you may be wondering why dry mouth causes cavities. Well, it's because saliva is our natural mouthwash. Its job is to neutralize acids, wash away food particles, and contain minerals that fight tooth decay. So if someone is not making enough saliva, it's not good for their oral health. And guess what? It's a very common problem as we age, and drugs are another problem causing our dry mouth, the drugs we use every day, and the side effects of medications. These drugs include those for blood pressure, depression, pain, sleeplessness, allergies, acid reflux, and the list goes on. So it is important you always ask your pharmacist if the medication you are taking might be contributing to a dry mouth. Factor 3. Reduced dexterity or difficulty with hand-eye coordination. If a senior has arthritis, Parkinson's, or has had a past stroke, or simply as we age, it can make it very difficult to brush and floss properly. Plaque then builds up on our teeth and provides the bacteria with food to produce acids and decay the teeth. Also, poor vision can make it hard to see if plaque is building up around the teeth. Now, let's talk about diet. Did you know that as we get older, our taste buds begin to diminish in number and become less sensitive? This, of course, leads us to add more sugar, salt, and spices to our food to compensate. And as a result, many seniors start eating softer foods like bread, crackers, and sweets, which can stick to the teeth and provide the perfect environment for bacteria to grow and cause cavities. Also, frequent snacking or sipping on sugary drinks or coffee throughout the day creates an environment of constant acid attack on the teeth, which can lead to accelerated decay. The fifth factor is old dental work. Over time, fillings, crowns, and bridges break down, and the margins or the edges of these old restorations develop leaky spots or cracks where plaque and bacteria can easily accumulate, leading to cavities around the old restoration of margins. And number 6, and probably the one that you didn't expect, is cognitive decline. Conditions like dementia or Alzheimer can make it very difficult for a person to remember and complete their oral hygiene routine consistently, leading to plaque buildup and subsequent cavities. So, did I miss anything? Let me know in the comments below if you have any thoughts or experiences that you would like to share with our community. And here's one I think you will enjoy. Until next time, stay strong, stay positive, and don't forget to floss.